Hey, what's up guys? It's David Warren. Thanks for watching. I'm a nurse practitioner and I've been an NP for a little over 4 years now, and I have absolutely enjoyed it. It's been one of the best decisions I've ever made. And I'm going to share with you today the top 5 reasons why I chose to become a nurse practitioner. And again, these are my own personal reasons. There's really no right or wrong reason for why somebody may choose or choose not to become a nurse practitioner. However, these are, again, my own personal reasons, and I'm going to share them with you here today. So the first reason is because of the schedule. I love the schedule of a nurse practitioner, and this is largely dependent upon the area in which you work. So for me, even going back to my bedside nursing days, I've only worked in the ER. I started out in a pediatric ER and then went to an adult ER, and as a nurse practitioner, that's really all I've ever done is work in emergency medicine. I've never worked in a family practice clinic. I've never worked in a clinic that's like a Monday through Friday 8 to 5 setting. I've only worked in the ER. And here's the reason for that. I love the schedule. So most groups that advanced practice providers work with are physician groups. And so there are doctors in your group, and then there are advanced practice providers. And being a nurse practitioner is quite different than being a bedside nurse for a lot of reasons. For one, it's the schedule. So as a bedside nurse, you're usually required to work 36 hours in a pay period, or in a week rather. So for 1 week, you'll work 3 12-hour shifts. And for each week, you have to get in your 36 hours. As an advanced practice nurse or as a nurse practitioner, it's slightly different. So for the emergency medicine groups that I've worked with, you don't have to put in a certain number of hours per week. All of our shifts are scheduled throughout the month. And so, for instance, whatever you're hired for, whatever your contract says, maybe it's 10 shifts a month, maybe it's 12 shifts a month, how many ever shifts you are contracted to provide or whatever you agree to, you usually just have to get those shifts in within that month's time frame. So again, you're not required to work a certain number of days per week, just as long as you get your shifts in per month. And for me, what that looks like is I may work 10 days in a row and then take 2 weeks off and then work 2 more days at the end of the month. It's really dependent upon, again, where you work and what your group does. This is really not a schedule for somebody that works in a clinic. So if you're interested in primary care, it's probably not going to be the schedule for you, because again, primary care clinics are open 8 to 5, emergency departments are open 24/7. So that's one reason I like working in the ER, and another reason why I like being a nurse practitioner is because I'm not required to put in a certain number of hours per week. I'm not required to work 3 shifts per week. I'm required to work how many ever shifts per month that I have been assigned to. And as long as I get those monthly shifts in, then I can kind of work whenever. And again, some emergency medicine groups have requirements for weekends. You're required to work 2 weekends a month. So maybe you do 5 days on, you're off for a week, and then you do 5 more days on, and then you're off for a week, and then you do 2 more days the following week. You can really arrange your schedule however you want. And for me, being a travel nurse practitioner and being self-employed, I basically work my schedule however I want to. So for instance, I know this summer I'm going to be taking probably 2 to 3 months off. And so in January, February, and March, I'm really going to try to work extra shifts. So I may be working 14 or 15 shifts each month to make up for the time that I'm going to take off in the summer. So that's the number one reason I like being a nurse practitioner, is the schedule. And if you work in a group, if you work in an emergency medicine group or a hospital medicine group, you can work your schedule usually how you want it. And being self-employed like I am, and being a travel nurse practitioner, having PRN jobs in a bunch of different places, I'm really not required to work at all. I'm required to work because I have to pay bills, but according to the group, I don't have to work a certain number of shifts. I can work kind of when I want, when the shifts are available. So the schedule is the first thing I really like about being a nurse practitioner. Number 2, I love the pay. And I will say this from the outset, you should not be a nurse practitioner for the pay. You should definitely not be a nurse practitioner for the pay, but I like the pay, and whatever work you do, you have to be fairly compensated for it. Whether that's an accountant, whether it's a physician, whether it's a lawyer, whatever you do, you're gonna be compensated for your work, and it's no different being a nurse practitioner. So I believe the average nurse practitioner salary is around $100,000 a year. Depending on your area, that goes up drastically. So for emergency medicine, the average hourly wage that I've seen is anywhere between $75 upwards of $150 an hour. So you can really make some good money being a nurse practitioner in the ER. And I would say most ERs, anywhere probably $85 to $100 an hour is kind of the norm. Again, some are less, some are down $60, $70 an hour, and some are up to $100 to $150 an hour. Totally depends on where you work, where you go, if you're in a rural area, if you're in an urban area. It completely depends on where you are. But the pay is excellent, and I love that aspect of it. Again, being self-employed, you can negotiate your own salary, you can negotiate your own contracts, you can pick the areas that pay the most, travel there and work and come back. The pay is great. I have thoroughly enjoyed the pay. I know, again, for travel nurses, you guys make over $100,000 a year. As a travel nurse practitioner, you make anywhere from $200,000 to about $350,000 a year. That's kind of an average salary. And again, that's working 12 to 14 shifts per month, every month, not taking any time off. Again, for me, I like to take time off. I like the work-life balance, as we just talked about. So I'll work a few months, take some months off, and then go back. I try to work as little as I can. But again, pay is huge. I really like the pay. It's not the number one reason I went into this profession, but I really do enjoy the pay. It's great. The third reason I chose to become a nurse practitioner is because there's not as much hands-on work as there is as a bedside nurse. So there's not quite as much hands-on work. And what do I mean by that? So as a bedside nurse, you're going to be the one triaging the patient, putting in the IV, drawing the labs, administering the medication, taking the patient to X-ray, taking the patient to CT. There's more of a task role, more of a hands-on role associated with being a registered nurse. And it's not necessarily a bad thing. I mean, that's good. You get to really hone your tasks. You get to learn to be really good at IVs. You get to learn to be good at Foley catheters, putting in NG tubes. There are a variety of skills that you get to be really, really good at in a hands-on manner. However, as a nurse practitioner, you are taking a step back from the hands-on role, and you're more directing the care of the patient, if that makes sense. So instead of being the one putting in the IV and giving the medication, you're the one deciding, does the patient need an IV? What medication does the patient need right now? What do I need to do to direct the care of this patient in a more of a leadership role and more of a medical aspect? How am I going to treat this patient? What is my medical decision making going to be? And that's not to say that there are no hands-on aspects of being a nurse practitioner, because that's just not true. So as a nurse practitioner, you're doing more advanced skills. So in the emergency department, you are sewing people up, putting in sutures, putting in staples. You might be doing lumbar punctures. You might be intubating somebody, putting in a central line, putting in an arterial line. There are a variety of tasks that you will do in the emergency department in addition to directing the care of the patient. So you might be reducing a fracture, you might be doing a sedation in which you have to reduce a dislocation. There are a variety of things that you do as a nurse practitioner that are task-oriented. However, the main role is not a task-oriented role. It's to critically think and to direct the care of the patient and to come to a conclusion as to what's wrong with the patient, and does the patient need to stay here or do they need to go home? So that's really what you do in the emergency department. It's more of a hands-off role. You are, again, kind of directing the care of the patient, using your medical decision-making capacity to decide, does the patient need to be admitted, or do they need to be discharged, or kind of what does this patient need? And instead of being the one to perform those tasks, you're the one deciding if those tasks need to be performed. And then when you do perform a task, it's usually something a little more advanced, as we just talked about. So the fourth reason I became a nurse practitioner is because as a nurse practitioner, you can teach in an academic setting. So you can teach at the university level, You can teach in an NP program, you can teach in a BSN program. There are a variety of areas you can use your master's degree in an academic capacity. So for me, I teach adjunct faculty at a local university in a BSN program. And it's really fun because, again, I'm not a bedside nurse anymore, but teaching BSN students really allows me to kind of go back to the basics, go back to being a bedside nurse and really not forget what that's like. And so for me, I really enjoy that because I get to practice my IV skills, I get to practice my Foley catheter skills, my NG skills. So you're really keeping those skills that you learn as a bedside nurse, and you're getting to practice those as a nurse practitioner. Again, you're not doing it in the hospital setting, in your job as a nurse practitioner, but as a clinical instructor, you are instructing the students on how to do those nursing-based tasks. And at some point in my life, I'm probably going to be tired of practicing at the bedside, and I'm going to want to teach and kind of have a more laid-back role at the university. And so being a nurse practitioner really allows you to do that. You can do a lot. You can work clinically or you can work non-clinically. You can work in a university setting. There are a variety of areas. Teaching is one of the main reasons why I wanted to be a nurse practitioner. The last reason, the fifth reason why I became a nurse practitioner is because of the increased knowledge that you have. So the increased knowledge, and let me explain what I mean by that. So as a bedside nurse, you know a lot. You know a lot about nursing, you know a lot about pathophysiology, about pharmacology. As a nurse practitioner, you know more about treating the patient. So you know more about disease processes, you know about how to treat that, you know what conditions are emergent, what conditions are non-emergent, you know who needs to be admitted to the hospital, who does not need to be admitted to the hospital. And I'm more speaking from an emergency medicine standpoint, again, because that's my background. And I knew before I ever went to NP school, I wanted to work in the ER. And so you have increased knowledge, and that comes to use just in general life. For me, I love hiking, I love camping, I love anything outdoors. And so when I do my travel assignments to Alaska, I hike through the Alaskan backcountry all the time. And it's handy to know like how to put in staples or how to suture somebody or how to do a joint injection. If you have a fracture, you can do a hematoma block to help with pain. There's just a variety of helpful things, just like great life tips that you know as a nurse practitioner that you may not know as a bedside nurse or you may not know how to do. For instance, if you're in the backcountry somewhere and you fracture your arm, as a nurse practitioner, you know how to do a hematoma block, you know how to reduce it and splint it. Whereas a nurse, you may know how to do that, but then again, you may not be trained on that. And so I think as a nurse practitioner, you have just a lot of good life knowledge about what's emergent, what's non-emergent, and how to treat just a wide variety of basic conditions. So those are my top 5 reasons why I became a nurse practitioner. Again, it's not an all-inclusive list, but those are just some of my personal reasons why I chose to become an NP. And that decision has probably forever altered me. I've absolutely loved my choice to become a nurse practitioner. It's been hands down one of the best career choices I've ever made. And what I would like for you to do is comment below, let me know your top 5 reasons for becoming a nurse practitioner. Or if you are not a nurse practitioner, let me know why you would want to become a nurse practitioner. So I look forward to connecting with you, and thanks for watching. Have a good rest of your day.